Our discovery of Charlie's cleft was during our 18-week prenatal appointment. We were just going to find out if we were having a boy or a girl, and we got a lot more news than that.
Thanks to ultrasound, a lot of times now we identify children with the cleft before they're delivered. And so we'll meet with them. They can meet the whole team if they want. And it provides a lot of peace of mind for the families. So our team is registered with the American Cleft Palate and Craniofacial Association. And what that does is it ensures that we follow all the multidisciplinary guidelines that really characterize a modern approach to cleft care.
I specifically am a pediatric geneticist, so we evaluate the patients after birth, figure out if they have an underlying condition or if any testing should be done, and then we follow growth and development along with the pediatrician through the team.
There's 20 people on the team. There's 20 providers. There's orthodontia, there's oral surgery, there's genetics, there's pediatrics, there's ear, nose, and throat, there's plastic surgery.
And then we have a full team that does speech therapy, hearing assessments, training for nutrition early in life, psychologist, social worker, geneticist. So yeah, we offer the entire spectrum of care for kids with cleft lip and palate here.
After Charlie was born, we had just a little over 3 months, and then he had his lip repair and his first set of tubes.
It's obviously in a sensitive area around the mouth, the face, and the nose. So a lot of the post-operative precautions center around diet, changes in the diet, and that's probably one of the bigger things that you need to be prepared for.
We set up a feeding environment for them, so we take them through whatever feeding mode that they're using right now, and we help them implement better feeding strategies by maybe changing flow rates on the nipples, positioning techniques. So we have a whole bag of tricks that we go through during that evaluation process to see how we can get these kids to be more efficient and better feeders. For speech and language evaluations, we take the children through just some structured play tasks, just observing them interact with maybe their parents, looking at their speech, their language, their pragmatics, their social skills, see how they're developing, and if we need further assessment.
A cleft palate, it's repaired somewhere between 9 and 12 months. And then they come back to the team really for monitoring.
Wasn't able to breathe and swallow and eat correctly until that was repaired, but it was a major surgery, but it's amazing because now when he opens his mouth, you can tell that he had it, but the roof of his mouth is totally formed now. We really didn't know anything about cleft lip and palate. We didn't have anyone in our family who had that experience, so it was a lot of learning for us, but we felt like we weren't alone ever for a minute, so we were really supported the whole time.
Well, it's scary at first, no doubt, but it's manageable, and we have a whole team of people that do this all the time. We're going to walk you through every step of the way. I can't even overstate how helpful that is to families.
The face is a very sacred place. It's the seat of our identity, and I think these kids are super special, and we want to just help them in any way we can.
Whoa!
So on some level, you start to feel like they're all your kids too. When you follow them that long, they eventually will graduate from your care, and it's always a sad day when they do, but still, it's fun to see them grow.